Hello students, now let us study a module on cognitive skills. First of all, let us outline what are the learning outcomes of this module. After studying this module, you should be able to understand the term cognition and cognitive skills, know about the hierarchy of interventions and strategies, learn the basic cognitive skills, analyze the use of cognitive skills and evaluate the aim of cognitive skills. Let me first introduce you to the topic. There is a famous saying by Epictetus, man is not disturbed by things but by his opinions about things. The therapist's main work centers on the cognitions of the client. The realm of cognitive work of a client focuses on the opinions, attitudes, thoughts, schemas, beliefs of the client. While working on the cognitions of the client, the clinician needs to understand the level of cognitive development and the cognitive skills of the client. Interventions for each client need to be tailored according to their cognitive preferences, styles and abilities. Hence, a client having limited range of cognitive skills, complicated, complex and advanced techniques will not be beneficial for him. Thinking style is determined by emotional factors more than simply intelligence level of a person. Following Piaget's model of cognitive development, a client showing rigid, illogical and concrete thought is said to be at a primitive stage of cognitive development. This may reflect a lack of cognitive development and complexity. When this lack is not pervasive and occurring in certain situations, it can be attributed to emotional factors. Then the work of the client focuses on removing this interference and can help the client to function at a higher cognitive level with greater efficiency. Now let us understand what is the basis of cognitive work. The process of cognitive development moves through the development and modification of schemata about the world, a process that consists of organization and adaptation according to Piaget. As children grow and mature, they form schemata or thought patterns. As they move about in the world and have new experiences, they keep on modifying these schemata to assimilate and accommodate the new understandings. This helps the person adapt to the new changes and demands of the world. He organizes his present schemas and expands them and adapts using the old schemas. Hence, if a client's thinking is inflexible, they will be easily using information given by the clinician to form old schemata into new schemata called as organization and to accommodate the old schemata rather than to force assimilation where it is not appropriate. That is, it will lead to successful adaptation. The socio-cultural milieu, that is, the interaction with the caretaker and other adults and peers, strongly influence the types and styles of coping skills, problem solving skills and cognitive patterns or schema children will form and use. The primary mode used by the therapist for conveyance of message, guidance and encouragement is language. Language has to be adapted to the level of the client. For example, complicated language, jargons, sarcasm, etc. should not be used with children. Guidance and prodding can be used with children as well as adults. Thus, some factors that need to be considered by the therapist while working with clients are: number 1, the cognitive capacity and style of the client should be assessed before initiating cognitive work. Number 2, cognitive strategies should be chosen and adapted to the cognitive level of the client. The therapist should also check for forced assimilation by the client. Statements should be formulated as clearly as possible. Language should be adapted to the preference of the client, and the therapist should converse in the client's native language. Now let us understand what is the hierarchy of interventions and strategies given by Brems. Brems 2002 outlines the strategies for working with thoughts and cognitions of a client. These strategies are presented in a hierarchy according to the level of cognitive complexity required by the client and a number of other therapeutic issues. Brems orders these strategies as number 1, increasing level of cognitive complexity and flexibility required by the client and the clinician, and on the factor of increasing levels of depth in the cognitive shift or insight that will be achieved through their use. Also, it is done on the factor of increasing levels of understanding knowledge of a given client by the clinician. It is also done requiring increasingly stable rapport and sustaining attachment between the client and the clinician. Also, this hierarchy also includes increasingly reflective of the clinician's theoretical orientation. Let us understand the hierarchy of cognitive strategies and interventions given by Brems, which is highlighted in the table below. The first column gives the strategy, the second column gives the definition of the strategy, and third the purpose of the strategy. These strategies will be discussed in detail later on. The first strategy is imparting information, which is defined as providing objective knowledge or understanding the client did not previously have. And the purpose of this strategy is to alter a client's reaction or interpretation in response to a given situation. The second strategy is pointing out patterns. The definition of this strategy is pointing out and tying together multiple similar contents or messages given by the client over time. The purpose of this is to help the client recognize relational patterns, core affects or core beliefs that have become habitual or maladaptive to create motivational change. Third strategy is asking clarifying questions, which is defined as planfully or purposefully questioning to lead the client to an insight or understanding the clinician already has. The purpose of this is to facilitate self-discovery and understanding and having insight in the client. Another strategy is confrontation. Pointing out inconsistencies, discrepancies and mixed messages in the client's communication is the definition of this strategy. The purpose of this is to help the client recognize incongruence and help the client increase awareness and a new way of looking at old information. Next in the hierarchy comes the here and now process, which is defined as pointing out interactions with the clinician that mirror interactions, behaviors, attitudes or reactions also expressed with others. The purpose of this is to help the client gain insight about reactions, attitudes and behaviors that occur predictably and perhaps inappropriately in multiple contexts. The last strategy in the hierarchy is interpretation, which is defined as providing explanations based on knowledge of the client about the origins of a client's reactions, behaviors, interactions, etc. The purpose of this strategy is to help the client understand the reason behind reactions, attitudes, behaviors, etc. that manifest frequently, predictably or inappropriately. Now, let us come to the basic skills and strategies of cognitive work in detail. The basic strategies are simple and require less cognitive complexity on part of the client. These strategies are focused on increasing client information bank both about life in general and about himself. These strategies point out patterns or uses questions that are clear and sufficiently straightforward. The clients do not perceive these as challenging or confronting. Three strategies discussed herein are imparting information, pointing out patterns and asking clarifying questions. Now, let us discuss each strategy in detail. First strategy is imparting information. Some clinicians do not consider imparting information as a therapeutic strategy. They view it as psychoeducational intervention. Nonetheless, many clinicians use this strategy quite often. This strategy is best used when a client is working on factual information which is faulty, inadequate or incomplete. Since any kind of factual information is based on facts and truth, it can be verified and proved or disproved. It is not related to any set of opinions or values. Information is especially imparted if it can lead to revision, updating, expansion or completion of a factual set of information for the client. This in turn may lead to the client approaching a situation differently and have a different response. In sharing information, clinicians need to be careful not to be projected as arrogant, rather it should be a joyful and helpful process of sharing information. It should not demonstrate superiority of knowledge or power. It should not be presented as giving sermons or lecturing. Under this, some techniques mentioned are A. Psychoeducation. Psychoeducation involves providing information to the client about a developmental process. It is often used for group therapy targeted at anger management, parent education, stress reduction, etc. The clinician decides if there is a need to educate the client about developmental milestones of children, parenting, sexuality, resources available in the community and imparts information on these issues. The clinician does not make any kind of value judgments or share opinions on it. Thus, the clinician should have sound knowledge of scientific resources like journals, textbooks, etc. and should be objective and factual. His knowledge should not be guided by television, magazines, newspapers, etc. The second technique under this is normalization. Another way to impart information is normalization or universalization. Such a strategy is used when a client questions his or her own behavior which the clinician finds as appropriate. For example, stress experienced before marriage, or another example could be traumatic response of a survivor of a tragedy. The clinician helps the client feel normal about his response as anyone else in his place would have had similar reactions. When the clinician provides further information on what to expect in future, how to avoid additional problems in future, the psychoeducation is added to normalization. The clinician should be very careful while using this strategy as normalization of an unhealthy or maladaptive behavior could have serious effects. Another strategy to impart information is relabeling, also called as refocusing or reframing. This involves providing alternative labels or viewpoints for a situation with which the client has problems. For example, a client calling himself as cowardly may be relabeled as careful or cautious, and an overindulgent parent may be reframed as protective. This helps the client to look at information from a different perspective. However, clinician is required to make accurate description here and not do reframing for the purpose of feel-good factor for the client. It should not be indicative of personal values or inaccurate judgment of the clinician. Hence, this strategy requires a clear understanding of emotional and cognitive state of the client. Now, let us come to the second technique, pointing out pattern. There are certain habitual ways of responding that clients develop over time that are maladaptive and unhealthy, and the task of the clinician here is to point out these patterns. The clinician observes and explores where, why and how these patterns started to manifest themselves. There are 4 types of repetitive themes or patterns identified by Tabor in 1997. A is relational patterns. Relational patterns are interpersonal scenarios that client plays over and over again with a variety of people in a variety of contexts. For example, a client may get anxious in the presence of people from opposite gender. Some of these patterns are simple and overtly seen, and some of these are covertly and need to be keenly observed over time. Second is rigid cognitive beliefs. Faulty, selective and biased cognitive processing produces core beliefs which are reflected in a repetitive pattern of emotions or behaviors. The interpretation of different behaviors, reactions and effects show that they can all be attributed to these distorted beliefs. For example, if a client feels guilty of various events or situations occurring in his life, he may react differently at different times, like overeating, oversleeping, anger, etc. However, all these can be attributed to the same core belief, that is self-blame. Coming on to the third pattern is core affects. Each person has a different affective style. Core affects are long lasting and occur repetitively, shown in different situations and contexts, irrespective of circumstances. For example, a person may react with depression in all situations, even in neutral situations. Another kind of pattern is habitual behavior. In this, the client has certain behavior pattern which is exhibited in all relational, cognitive and affective patterns. These behaviors are same irrespective of external event. These are no longer useful or adaptive. For example, a client may shout when he is happy, sad or when things do not work. These are easily identified in a session. The task of the clinician is to help the client recognize these behaviors. Sometimes clients do not recognize that they exhibit these behaviors with people again and again. They are unaware of their repetitiveness of their thoughts or emotions. These patterns developed as they were adaptive in nature in the beginning. It may be for self-protection, enhancing self-concept or dealing with a difficult situation. However, now these patterns become rigid and difficult to change. Hence, first step in working with client is to help them recognize these and become aware of these patterns. Next is the task of explaining to the client the reason of the pattern's development. Finally, using other advanced cognitive techniques, the clinician can work upon the modification of these patterns. The pointing out of patterns simply constitutes of therapists repeating events, reactions or contents the client has communicated over time to identify the common thread, maybe relational, affective, cognitive or behavioral, that ties them all together. The therapist shows the connections to the client, making him realize that these all have the same basic process behind it or are symptoms of a single problem. This is done in a careful and respectful manner so that the client does not feel evaluated. Later, the client will begin to independently identify these. Hence, the process of therapy starts with awareness and identification of patterns. It later aims at insight and behavior change. Now, let us come to the third technique, asking clarifying questions. Clarifying questions serve different purpose than open-ended questions. Open-ended questions help in elaborative communication. Clarifying questions have the clear aim of leading the client towards recognition, insight, conceptualization or understanding that the clinician has arrived at, which the client does not have as yet, but can be brought into this understanding. It is purposely aimed at self-discoveries and insights. It helps client gain confidence in therapeutic process and sees their own progress. Hence, to summarize, the aim of all the basic cognitive skills discussed herein is to solve problems, generate solutions, help in decision making, reveal incongruence and contradictions, develop insights about habitual patterns of relating, discover transferences, explain behavior, thoughts, affects and interactions, create understanding and self-awareness and knowledge about the causes of behaviors, thoughts and affects. Now, let us summarize what all we have learnt in this module. The realm of cognitive work of a client focuses on the opinions, attitudes, thoughts, schemas, beliefs of the client. While working on the cognitions of the client, the clinician needs to understand the level of cognitive development and the cognitive skills of the client. Interventions for each client need to be tailored according to their cognitive preferences, styles and abilities. The socio-cultural milieu, that is the interaction with the caretakers and other adults and peers, strongly influence the types and styles of coping skills, problem solving skills and cognitive patterns or schema children will form and use. The strategies chosen should be matched and adaptive to the cognitive capacity and the style of the client. This should be assessed before initiating cognitive work. The basic strategies are simple and require less cognitive complexity. The strategies given by Brems are focused on increasing client information bank, both about life in general or about himself. Brems 2002 had outlined the strategies for working with thoughts and behaviors and cognitions of a client as increasing level of complexity and flexibility required by the client and the clinician, increasing levels of depth in the cognitive shift or insight that will be achieved through their use, increasing levels of understanding and knowledge of the client by the clinician, requiring increasingly stable rapport and sustaining attachment between the client and clinician, increasingly reflective of clinician's theoretical orientation. These strategies are focused on increasing client information bank, both about life in general and about himself. These strategies are imparting information, pointing out patterns and asking clarifying questions. Hence, to summarize, the aim of all basic cognitive skills is to solve problems, generate solutions, help in decision making, reveal incongruence and contradictions, develop insights about habitual patterns of relating, discover transferences, explain behavior, thoughts, affect and interactions, create understanding and self-awareness and knowledge about the causes of behaviors, thoughts and affects. Thank you.